Hello, I'm Dr. Karim Kurji, York Region's Medical Officer of Health. Our new cases have been declining. In fact, the incidence of new cases is 9.8 per thousand population. That is amongst the lower ones in the GTA. Many of our outbreaks have come under control, although there are a few that are posing unusual challenges. Workplace exposures, though, are on the rise, and I would urge employers to look at our website, york.ca/COVID-19, for resources, as well as the website of the Public Services Health and Safety Association, which is pshsa.ca. You can also get PPE from a list of suppliers at ontario.ca/PPE. Children in Canada have constituted about 5% of the COVID-19 cases and have contributed to 1% of the hospitalizations in Canada. The most common symptoms in order of frequency is dry cough, fever, sore throat, shortness of breath, and diarrhea. However, between 4 and 16% of the children have not had any symptoms at all. Studies in the US have found that 9 out of 10 of these children have acquired their infections from household contacts. Studies in China have shown that children are just as likely to acquire COVID-19 from household contacts as are adults. There's a rare syndrome called multisystem inflammatory syndrome that occurs in children. It presents with persistent fever, severe gastrointestinal illness, nausea, vomiting, diarrhea, and a rash. It usually occurs weeks after COVID-19. Unfortunately, many parents may not even realize that their children had COVID-19 because they may have been asymptomatic at the time. We haven't seen any such cases in York Region, but there have been cases in Montreal, Calgary, and of course many cases in New York City. So we would like you to seek urgent medical attention should you come across those symptoms in your children. There are also skin changes that are associated in 20% of the COVID-19 cases for children. Commonly, these occur as purplish red papules or nodules that appear on the toes, sometimes referred to as COVID toes. Please ensure that you take your children for testing should that happen. Children, like adults, also need to keep their physical distance of 2 meters from other children from other households, or for that matter, other adults from other households. And it is important that they wash their hands frequently, preferably with soap and water. With respect to masks, for adults, we recommend a 2-layer cloth mask when physical distance cannot be maintained, such as when taking the transit or going to grocery stores. The Public Health Agency of Canada and the American Academy of Pediatrics also recommends face cloths for children over the age of 2 years to be used for brief periods when they cannot maintain the 2-meter distancing. Please make sure that if you have COVID-19-like symptoms, and that includes your children having mild COVID-19-like symptoms, please ensure that they go for testing at one of the 3 assessment centers we have in the region. These are the 3 hospitals, South Lake, Markham Stouffville, and Mackenzie Health. And they are open during the weekends as well. Finally, stay vigilant and stay safe. Thank you.